Now I will be discussing an ECG with atrial flutter, and the mechanism of atrial flutter will also be discussed. Even though in the ECG which I am going to present first, recognition of atrial flutter will be very easy, but do not think that it is always so easy. Atrial flutter is an arrhythmia which can be missed on the ECG, which I will come to during the discussion. Anyone with a basic knowledge of ECG can easily recognize the flutter waves, sawtooth shaped flutter waves in this ECG. So no points are scored for diagnosing atrial flutter in this ECG. There are some other things to be thought of. Here you have two RR intervals and there are three flutter waves in between. But this is not 3:1 conduction, but 4:1 conduction, because you see the interval between these two P waves and the interval between these two flutter waves, not P waves. So this is double. So naturally there is one flutter wave hidden within the QRS. So if you count that, that will be 4:1 flutter. Otherwise you have to say the ratio by calculating the RR interval and the FF interval, and comparing these two you should say the ratio. Similarly, this is 2:1 conduction, because there is one flutter wave here and another will be there, and this rate is around 150 per minute, and flutter rate is usually around 300 per minute. So this is 2:1 conduction, this is 4:1 conduction, this is again 2:1 conduction. Here you have 3:1 conduction. There are two flutter waves in between and there will be one on this QRS also. So there is a variation in flutter conduction in this case. Then it is easy to recognize the flutter waves because you will see the flutter waves between the RR intervals. Suppose it is 1:1 conduction, it is almost impossible to recognize flutter, because for every flutter wave there will be a QRS. Then the rate is also going to be very high, 300 per minute. But typically for atrial flutter there will be at least 2:1 block and the rate will be 150. So the dictum is that whenever you see a tachycardia, a narrow QRS tachycardia at 150 per minute, think of atrial flutter, because atrial flutter